Good morning to all. I am Dr. Sugunadevi, Assistant Professor, Department of Biochemistry. Now I am going to discuss about oncology. What is meant by oncology? Oncology means it's one of study of cancer. In the word, different types of cancer will be caused by the patients. So what are the cancer means? Skin cancer, colon cancer, breast cancer, blood cancer, oral cancer and brain cancer. So what is how we can affect the cancer means, cancer in our body having trillions of cells are present. So what are the role of these cells? If the cells is going to doing the proper functions of our body, cell cycle analysis, cell division, so such as etc. If the cells having any one of the radiations, any one of the carcinogen will come and attack, what will happen after that? It will leads to the come to the cancer development. So cancer means it's nothing but it's one of the disease or disorder of the gene. So if the gene affect the somatic mutations, it will mainly complicated for the cancer development. Cancer development is the regarded of the cancer accumulations of the somatic mutations leads to uncontrolled growth of cells, so abnormal cell division, abnormal cell cycling analysis, and then if these parameters will be mainly in this cancer conditions. So and then risk factor. What are the risk factors for causing the cancer? So first one is diet and nutrition. Diet means it will decreased intake of diet, it will mainly causes by the cancer development, because if the nutrient content of the food it will be low, this is the main causes of cancer development. And then tobacco chewing, it contain polyaromatic hydrocarbon. If the chemicals, it will be causes oral cancer development. And then radiation, some of the radiations, alpha radiation, gamma rays, cosmic rays, if the radiations produced from sun rays, it will be causes the skin cancer. And then next, some of the viruses, papilloma virus, hepatitis B, hepatitis C, if the virus is causing the liver cancers. And then alcohol drinking, alcohol contain nitrosamine and aldehyde. If the chemicals, it will be causes the cancer development. So after the risk factor, you have to find out the symptoms. What are the symptoms during the cancer condition? Means fatigue, weight loss, body changes, skin rash, fever, everything will be causes the during this cancer conditions. Next, after they have to find out the symptoms, we are going to diagnosis of this cancer. So what are the diagnosis? Screening, self-examination, and some of the scans, CT scan, MRI scan, and X-rays, etc. And then molecular diagnostics test. After the diagnosing, we are going to the treatment of this cancer condition. First one is chemotherapy. Chemotherapy means how to induce the drug if the drug curing the cancer. And then next surgery, you have to find out size of the tumor. It will be we have to go into the surgery process. And radiation how to induce the radiations of the cancer, and the radiations along with the surgery to both of us the treatment of the cancer condition. And then another therapy also will be given. So what are the therapy means? Immunotherapy, hormone therapy and gene therapy. Next one is hallmarks of the cancer, some of the staining, evading. So some of the 7 parameters of the involved in the cancer development of the hallmarks of the cancer. And then next one is some of the genes will be involved in this during this cancer conditions. What are the gene? 2 types of genes will be present in our cells. One is oncogene and another one is tumor suppressor gene. Tumor suppressor gene is one of the P53. If the gene, what is the role of this gene? The gene is going to cell cyclic process and involved in the apoptosis process. If the genes, and then oncogenes, it will be going to the synthesis of the cancer cells. So if next, the carcinogenesis contains 2 types of genetic alterations will be occur. First one is genetic alterations and another one is epigenetic alterations will be occur during these cancer conditions. Next one is tumor suppressor gene. Some of the DNA, after the DNA damage, so the P53 also will be affected. After P53 will be affected, it will be going to the decrease the cell cycling, increase the cell cycling process, and apoptosis will be decreased apoptosis will be occur during the tumor suppressor gene. And then proto-oncogene, some of the cancer exposing agent will going to the attack the DNA molecule. So here the gene of the oncogene is converted to proto-oncogene. In the proto-oncogene going to the bind to the DNA molecules. In the DNA molecules, it leads to the occur the mutations of somatic cells, and it produce the development of the cancer. Step of the multi-step carcinogenesis. So during different types of cancers in the human population in the world. So first one is pre-neoplastic changes of the tumor, it convert to the malignancy conditions. 3 types of tumorigenesis will be occur. First one is initiation, promotion and progression. So first step, initiation means we have to expose the carcinogen to the cell, expose to the carcinogen to the cells. If the cells is converted to the damage of the DNA, it will be taking place of the 1 or 2 days only if the timing lifetime of this initiation process. Second step, promotion condition. Promotion conditions, what is in the promotion condition? Next step. So it will be taking long time or decade after the DNA damaging cells going to the mutated. If the mutated cells is converted to the pre-neoplastic changes, if the pre-neoplastic changes leads to the increased cell proliferations and decreased apoptosis. So this is the promotion condition. Next one is progression. Progression conditions. So what are the progression condition? So final step, that is means neoplastic of the tumor convert to the neoplastic, pre-neoplastic converted to the neoplastic conditions, that is pre-malignancies, malignancies converted to the malignancies condition. During the malignancies conditions, genetic accumulations will be occur in the cancer cells. What is the genetic? 3 types of genetic changes will be occur during the final step of progression conditions. What are the step means? First one is oncogene, proto-oncogene, some of the DNA repair mechanisms involved in the gene. This gene, 3 types of genes will be going to be involved in the genetic instability and then chromosomal aberrations and then micronucleus formations, then mutations, some of the point mutations, some of the mutations will be occur. Maximum after the malignancies conditions, what will happen means finally angiogenesis mechanisms will be occur. What is angiogenesis means? Formations of new blood vessels around the tumor tissues. If the tumor tissue absorb the nutrients from the blood and it will be grow the larger sized. So this is called as the angiogenesis mechanism. So finally overview of carcinogenesis. In first step, we have to expose any one of the carcinogen. If the carcinogen goes to the bind to the normal cells of the DNA, so already in our body having doing proper functions of the normal cells, that is DNA repair mechanism, cell cyclic process. But after exposing the DNA, if the DNA going to the damages, so DNA after the DNA damages going to the somatic cells, mutations will be occur. Somatic cells mutations. After the somatic cells mutations, what will happen means activation of growth proto-oncogenes and inactivations of tumor suppressor gene. So if both of the genes will be alter the gene product and abnormal structural regulatory proteins, and finally during the malignant tumor will be occur. So next conclusions of these tumor conditions: increase the number of cancer patients every year, and then carefully about diet and lifestyle, how to follow the proper diet, and then we have to given the proper awareness to the patient of the population. So pre-frequency cancer, what is meant by cancer and what are the stages of this cancer, how we can affect the cancer, what are the symptoms of this cancer, what are the genes involved in this what are the changes, abnormalities, changes will be occur during the cancer conditions. And then next one is references. So these are my references of this preparation of my slide. And the next, thank you.